Assalamu alaikum. Bismillahirrahmanirrahim. Today my topic of presentation is public health surveillance. Learning objectives of today's presentation is surveillance, types of surveillance, purpose and uses of surveillance, methods of surveillance, surveillance cycle, difference between surveillance, screening, monitoring and survey. Conclusion, recent advances and MCQs. By the end of this presentation, participants will be able to describe the surveillance, types of surveillance, its purpose, methods of surveillance, surveillance cycle, difference between surveillance, screening, monitoring, and survey. Now, the definition of surveillance. It is actually the ongoing systematic collection, analysis, and interpretation of health data which are used in planning, implementation, and evaluation of public health practices, closely integrated with timely dissemination of these data to those who need to know. Surveillance ranges from compulsory notifiable disease, specific disease registries, which may be population based or hospital based, continuous or repeated survey of representative sample of the population to aggregate data for recording trends on consumption patterns and economic activity. If we see the enabling components of surveillance system, it may include the laboratory diagnostics to detect or confirm health condition, information technology to support the surveillance processes. For example, its function of data collection, analysis, and dissemination. One of the component may be clinician consultation and reporting, laboratory worker education and training, legislation and regulations, policies that support the conduct of surveillance systems, and directories for disseminating alerts, bulletins, clinical guidelines, and prevention recommendations, program administration and management. Actually, the public health surveillance is served as early warning system for impending the public health emergencies. It also documents the impact of intervention or track progress towards specified goals. It helps guide health officials and program in directing and conducting disease control and prevention activities. But the surveillance does not include control or prevention activities themselves. They can only guide the prevention or control program in directing and conducting these any communicable or non-communicable disease control and prevention activities. But the surveillance itself does not include any control or prevention activities. The surveillance should not be confused with medical surveillance, which is actually the monitoring of exposed person to detect early evidence of disease. Uh, and also the public health surveillance is a continued watchfulness for any public health problems, and it is not actually a data collection system. If we see the dynamic vision of surveillance, all levels, it include the collection and transmit of data. Then these data analyze, there is feedback information, and then decisions are made. All levels use information to make the decisions. Uh, for example, if we see the steps in establishing and maintaining surveillance system, first of all, we establish any goals, develop the case definitions, select appropriate personals or workforce, then acquire tools and clearance for collection, analysis, and dissemination which are required. Then we implement the surveillance system, and after implementation, the next step is to evaluate the surveillance activities. Then, if we see the purpose of surveillance, as I already mentioned, that it established the baseline of health condition, it understands trends and pattern of disease, it detects outbreaks of emergence of any disease or outbreak, it estimates the magnitude of burden of health problems, identified resources need during and after public health emergencies, it evaluates public health programs and control measures, determine the nature and history of disease, monitor changes in infectious agent, set for research priorities, it can stimulate research, inform research plan and implementation, support public health program planning, and it monitor changes in public health practice source. Therefore, at local level, surveillance purpose is to trigger basic public health investigation of disease outbreak and its specific control activities predominantly mainly for infectious disease, which is communicable disease and environmental hazards. At local level, the major function of surveillance is to identify any disease outbreak predominantly of communicable disease and its specific control measures. But at the main national level, activities including major are the measuring trends in risk factor and disease, monitoring the effectiveness of any specific disease intervention, conducting more complicated analysis at national level to determine the risk factor and providing technical assistance. But at the intermediate level, which includes state or province level, public health agencies typically share both perspectives. How we can surveillance data can be used? We can, as already mentioned, it can be used as estimation of burden of health problems. It can use for natural history of disease, detection of epidemics, distribution and spread of health events. It can used in hypothesis testing, evaluation of control and prevention measures, monitoring changes, detecting changes in health practice, and facilitate planning. If we see one by one, that estimate surveillance data can be used as estimation of health problem. It includes the quantitative estimates of magnitude of health problems. For example, if we see the include sudden and long-term changes in trends, if we see the total COVID cases in Pakistan from February to December 2020, we can see through graphical representation. Therefore, it can also use estimate of health problems. It can also portray the natural history of disease, for example, clinical spectrum of disease. It can also be used for detection of It can also be used to natural history of disease, naturally, and also tells about the current and historical case recovery and death counts of any disease. It can also be used for the distribution and spread of health events. I also mentioned it can use for hypothesis testing, which can use in facilitation of epidemiological and laboratory research. It can also use evaluating the any control and prevention measures of any disease. Also use monitoring changes in infectious agent and host factors. It can also use detecting changes in health practices. It can use in facilitate planning. For example, it can identify target population in need of health services. For example, refugee population or morbidity surveillance in emergency shelters. It identify health topics to be addressed by educational programs and media outcome. Therefore, we can see that surveillance is used in various purposes and uses. If therefore surveillance is outcome oriented, it can measure frequency of any illness or injuries. For example, it can in the form of cases, incidence, or prevalence. It can also measure the severity of conditions. For example, hospitalization rate, disability, or case fatality. It can also measure impact of condition. For example, impact is in the form of cost. It can also orient data by place, person, and time, which is also known as descriptive epidemiology. Therefore, what should be under surveillance? Surveillance can establish priorities based on frequency, for example, incidence, prevalence, and mortality of disease on the basis of severity, for example, case fatality rates, hospitalization rates, disability rates, cost, direct and indirect cost, preventability, communicability, public interest, and it will be useful for public health action. Surveillance methods. In this, first of all, we important to clearly define the definition any condition, and it ensures some criteria that are same criteria that are used by all. It makes the data more comparable. It includes person, time, place, and distribution. May define suspected and confirmed case. May include symptoms, lab values, time period, population as appropriate. For example, if we see the case definition of suspected measles, it should be include any person in whom a clinician suspect measles with fever, generalized maculopapular rash, which is known vesicular cough, runny nose, and conjunctivitis, red eyes. And laboratory diagnosis of measles include presence of measles-specific IgM antibodies. And outbreak case definition therefore differs from routine surveillance definition, which should be epidemiological link cases often included. Therefore, various case definitions, first of all, should be established. As I already mentioned, examples of measles. There should be clinically confirmed measles, laboratory confirmed measles, which is IgM detection, epidemiological confirmed measles, which is actually a case that meets the clinical case definition and is linked to epidemiologically to laboratory confirmed or either any another epidemiological confirmed case. and there should be discarded case, which is suspected case that has been subjected to serology or virus identification but has not met any laboratory criteria for diagnosis. Surveillance methods. There are many surveillance methods for data collection. Actually they can use the data standardized instrument field visits. There are mostly two types of surveillance for collecting data. One is active surveillance and other is passive surveillance. Active surveillance is actually the health department initiated. In this, the health provider contacted on regular basis to collect information. These are more source-intensive surveillance. It's used on mostly for outbreaks or pilot studies. And in this, the screening is essential step in most of the disease in conducting the surveillance. Whereas, as the name shows, the passive surveillance is provider initiated. The providers are responsible for reporting. Health department waits to receive the reports, and it's the problem associated with this surveillance is underreporting of data. Therefore, passive surveillance is provider initiated and active surveillance is actually conducted by health department, and it is health department initiated and screening is essential step in active surveillance. If we see the gross difference between active and passive surveillance, we see active surveillance is actually actively looking or searching for particular disease, whereas passive surveillance is collection of data from persons themselves reporting to facility, which include hospital, clinic, sub-center, primary healthcare center, community health center, whereas active surveillance include active participation of health workers as well as community. Degree of reporting is more complete in active surveillance. It required important strategy. Important for malaria control is still going and strong. It has been undertaken also for acute flaccid paralysis. Whereas passive surveillance at times during outbreak investigator may conduct what is sometimes called stimulated or enhanced passive surveillance by sending a letter by describing the situation and asking for report of similar cases. Therefore, the surveillance method is actually collecting whether through active surveillance or passive surveillance the data is collected. Then the next step is the data analysis. The data analysis actually the ongoing reviews. It includes the descriptive statistics reporting or multivariate analysis or automated analysis. In this, we can use the frequency or bar charts to show any burden of disease, confirmed cases, active cases, the mortality rates. Each level, the data analyzed at its level. Reporting units may be count. District level, we can divide calculation of rate, compare time, place, and person. At state level, there is more extensive analysis and more complex analysis. Then come up at as more hierarchy at higher hierarchy, for example, state analysis. And there is no need to wait for feedback from upper level. All levels do their analyze your data. And after the analysis, there comes the interpretation and dissemination of data. The presentation of surveillance data can be in the form of tables, graphs, maps, etc. They can disseminate data in the form of mortality, morbidity, weekly reports, surveillance summaries, surveillance reports, annual summaries, or medical literature. Then after analysis and report dissemination, there is also become the surveillance method evaluation. This include did the system generate needed answer to problem, was the information timely, was it useful for planners, how was the information used, was it worthful in the effort, and what can be done to make it better. Each level used the for action at level. Each level use information action at its level. Reporting unit investigate an outbreak. District level focus resources on area with a high incidence, and state level redesign a program to meet changing need if it is needed in evaluation. And no need to wait for instruction from upper level. All levels make the same. Therefore, we can see that cycle of surveillance include data collection, which I already told, pertinent, regular, and frequently timely data collection, consolidation and interpretation. This should be orderly, descriptive, and evaluation. Then come the dissemination of data, which is actually prompt to all who need to know, for example, data provider and action taker. Then come the action to control and prevent, and at the end, evaluation. And I clearly describe each step. Then come the initiating surveillance system activities. It includes choose a disease that has proven control measures available, define how data collected should be used, set a standard case definition, use existing system, visit those who supply data, develop a database, develop a regular reporting system for distribution, for example, feedback. Actually, the disease selection criteria for surveillance eligibility include it should be public health problem, it should be quantitative burden of disease, it impacts clinical spectrum severity, communicability, epidemic potential, it should be their preventability in terms of feasibility or cost, there should be risk perception, there should be global health organization, national authority, NGO, people or critical pressure. Prerequisites of effective surveillance system also include the standard case definition, enumeration of reporting unit, system for disease surveillance, notifiable disease reporting system, laboratory-based surveillance, hospital-based surveillance, or population-based surveillance. Disease notification in the surveillance should be report of cases individually or collectively, report of epidemics, case reports regularly required, selectively reported in endemic areas, or obligatory reporting of epidemics. Steps for disease notification include collect basic data, compile at district, state, and national level, and then report district, state, or national authority to WHO. Therefore, if we see the types of surveillance according to these, there should be a focused location for surveillance such as health facility based surveillance, a designated or representative health facility reporting site for early warning of epidemic, surveillance conducted at laboratories, disease specific surveillance, data sources uh, used for public health surveillance. Actually, the data collected through vital registration, disease notification, environmental monitoring, and population surveys are commonly used for surveillance of health related problems. Data from randomized controlled trial typically cover only a specific or selected population and are used to answer specific questions about the effectiveness of particular treatment. Therefore, and they are not useful for surveillance. Therefore, the data mostly generated from disease notification, vital registration, registries, sentinel surveillance, syndromic surveillance, administrative data, or surveys are mostly used for surveillance purpose. But the clinical trial, randomized trial, um, rarely used, or they are used typically for a selected, specially population only. And the most level, the data sources is already mentioned. Now, what is a syndromic surveillance? Syndromic surveillance is a type of surveillance which is used for early detection of outbreaks, to follow the size, spread, and tempo of any outbreaks, to monitor disease trend, and to provide reassurance that an outbreak has not occurred. It is actually for early detection of outbreak. It is a fundamental objective of syndromic surveillance is to identify illness cluster early, before diagnoses are confirmed and reported to public health agencies, and to mobilize a rapid response, thereby reducing the morbidity and mortality. Therefore, its main aim is to identify cluster early before diagnosis, so that there should be early diagnosis of outbreak, and there should be a rapid mobilization of public health rapid response. If we see the rationale for early detection, if we see there is days and number of cases, there is a release of outbreak, and then and the second day there is symptom onset, and then 11 at 11 days it can start, and there is severe illness. Another graph is severe illness. Actually, the time between the detection of syndromic surveillance through pre-diagnostic surveillance and detection by traditional syndromic time-based surveillance is decreased, and therefore this can lead to early detection of cases or cluster of disease. The difference between these two times, and it can lead to decrease in morbidity for early detection, so that we can early mobilize a rapid response system. Electronic surveillance is also the National Electronic Disease Surveillance System. It is actually a set of criteria developed by CDC that all public health surveillance system must meet. Used to manage state-wide reportable disease surveillance data, it is supported by CDC fund. Sentinel surveillance. It is actually the monitoring of rate of occurrence of specific disease or condition through a voluntary network of doctors, laboratories, or public health departments, with a view to assess the stability or change in health level of population. A sentinel surveillance system is used to obtain data about particular disease that cannot be obtained through passive system. Data collected in well-designed sentinel system and can be used to signal trends, identify outbreaks, and monitor disease. Sentinel system involved network or reporting site, typically doctors' laboratories. Data collected are not representative and not generalized. So surveillance sites must include commitment to resource the program, a high probability of observing the target disease, a laboratory capable of systematically testing subjects, experienced or qualified staff, or relatively large population. Mostly used Sentinel site has become the preferred approach for human immunodeficiency virus HIV surveillance for certain countries where national population based surveillance for HIV is not feasible. And this approach is based on periodic serological surveys conducted at selected sites with well defined population groups. Because underreporting is common for such type of disease, therefore, an alternative technique which is recommended by CDC and WHO is used sentinel sites or sentinel surveillance for such type of disease. Interpretation of surveillance data. There is limitation of surveillance data. For example, there should be underreporting, biased reporting, inconsistent case definitions, consider context. There should be seasonality and recent policies changes or intervention. There should also the lack of representative of reported cases, inconsistent case definitions, reason for not reporting any disease. Assume someone else reporting didn't know reporting was required, didn't know how to report, concern about confidentiality and doctor-patient relationship, and there is no incentive to report time-consuming or unaware of value. Now, how we improve reporting? We can contact physicians in the community, tell them about health departments who are interested in morbidity reporting, maintain a reasonable list of reportable disease, maximize conduct, maximize contact through presentations, mailing, or newsletter. Use the data. Therefore, good surveillance system should be simple. There should be ease of operation, minimum paperwork, simple definition using existing system. It should be acceptable, flexible, sensitive. There should be predictive value, representativeness, timeliness, regularity, data quality, and cost effectiveness. There should be now a difference between monitoring and surveillance. Monitoring actually the specific and essential part of surveillance, whereas surveillance is broad term, monitoring is one of its component. Monitoring is carried out by any technician or any automated machine, whereas surveillance is required professional analysis and sophisticated judgment of data. Monitoring is required for military standard, whereas surveillance lacks for military standard. Monitoring is actually differentiate between acceptable and unacceptable change, whereas surveillance does not differentiate between acceptable and unacceptable change. If we see the difference between screening and surveillance, screening is actually active search for or process of detection of disease among apparently healthy people, whereas surveillance is ongoing systematic collection, analysis, and interpretation of health data for use in planning, implementation, evaluation of public health closely integrated with timely dissemination of data. Prevention level screening is secondary level of prevention, whereas surveillance is primary level of prevention. Both have low cost. Target population for screening is apparently healthy, whereas surveillance target is population. If we see the difference between surveillance and survey, surveillance has been defined as systematic collection, analysis, and dissemination of data which are used for policymaker and other. Whereas survey is a method of gathering information from a sample of people, traditionally with intention of generalizing the result to larger population. There may be four modes of survey: face-to-face, telephonic surveys, self-administrated surveys. Surveillance provides the knowledge to support health promotion and disease prevention and should be take place in context of effort to improve population health, whereas surveys are used done only once to determine the distribution of risk factor in population at a point in time. Surveillance allow to collect limited number of data, whereas survey allow to collect wide variety of data. Surveillance allow tries to collect data on every case of disease, whereas survey usually data collection is done on sample of population. Data collection is only for numerator. We have to get data for denominator from other sources in surveillance, whereas survey data collection allows to calculate incidence and prevalence rate. Conclusion. Surveillance provides information on health of status of the community. Public health relies on information from medical care providers and takes prevention-oriented action based on information received. Surveillance involves taking information in, analyzing and interpreting it, and disseminating it to those who need it. Now come recent advances. There is 2020 paper is published about the application of internet-based sources of public health surveillance, infovilance, or systematic review. According to this article, the public health surveillance is continuous and systematic collection, analysis, and interpretation of data. This informs the development of early warning system to monitor epidemic and documents the impact of intervention measures. The actually objective of this article is to assess the research finding regarding the application of internet-based resources for public health surveillance, which is also known as infodemiology or infovilance. To achieve this, they present a comprehensive systematic literature review. And they are conducted publications between 2012 to 2018 that leverage the internet-based sources for public health surveillance, outbreak forecasting, disease characterization, and diagnosis prediction. Results show that a total of 162 publications they determine infectious disease to be preferred case study. 66% of the 8 categories of internet-based sources, search queries, social media news, discussion forum, website, and web encyclopedia, search queries, and social media apply to 95% of total reviewed publication. They concluded that the internet-based resources are a valuable proxy to study illness affecting the general population. However, it is important to characterize which diseases are best suited for available resources. The literature shows that the level of engagement among online platforms can be potential indicator. There is necessity to understand the population online behavior in addition to exploration of health information dissemination and its content is significantly unexplored. Another article published which can recognizing the hidden strengthening the HIV surveillance among key and priority surveillance in Mozambique. According to this abstract high quality representative data from HIV surveillance have country ownership and commitment. They describe the experience of strengthening the HIV surveillance system among those population through the implementation of these. The key lesson learned used that there is importance of multi-sectoral collaboration, vital role of data to support key population visibility, and there should be traditional surveillance methodologies from routine data to capture the hidden population mostly of HIV. Another article published that infectious disease surveillance in Pakistan challenges effort and recommendation. They show that public health remains a major concern in Pakistan, with communicable disease include AIDS, hepatitis B, C, and tuberculosis, the leading cause of morbidity. And due to absence of comprehensive surveillance strategy and mechanism, it has been difficult to manage infectious disease outbreak effectively in Pakistan. They present various surveillance system and programs established in history. For example, in Pakistan, Vision 2020 is actually aimed improving disease surveillance, disease early warning system, which can detect any epidemic signs at an early stage. National Tuberculosis Control Program, disease surveillance control system in Punjab, which actually the outbreaks of vector-borne disease, integrated disease surveillance systems, Khyber Pakhtunkhwa, Center for CDC in collaboration with Pakistan National Institute of Health, which are also important for public health issues such as workforce development, hepatitis, influenza surveillance, and polio eradication. These are some surveillance system and programs working in Pakistan. Now time for MCQs. MCQs 1. Data and information from public health surveillance are used to assess and characterize the burden and distribution of adverse health outcome, occurrences. Public health surveillance include which of the following activities? Alpha disease control, beta disease elimination, C data collection and analysis, D disease eradication, and E disease extinction. What will be the correct option?
C.
He will be the correct option as already mentioned that the public health surveillance actually the data collection analysis. It does not include any disease prevention and elimination steps or control. MCQs 2 and XYZ country population health improvement depends on surveillance. Which of the following statement most accurately summarize public health surveillance? Alpha method to monitor occurrence of public health problems. A program to control communicable disease outbreak. C program to control occupational disease. C Delta as a system for collecting health related information. E a program to control non communicable disease. What will be the correct option?
B.
Alpha, public health surveillance is actually a method to monitor
A.
occurrence of public health problems. Uh, Public health surveillance does not include any prevention or control activities, but actually it guide to direct any control program activities regarding communicable disease. Therefore, alpha will be correct option. MCQs 3. Third, public health surveillance in XYZ country is important to monitor public health practice. At the local level, surveillance triggers basic public health intervention of disease outbreak and specific control activities, predominantly alpha of chronic disease, beta communicable disease, C occupational disease, presence of virus in mosquitoes, or E non-communicable disease. What will be the correct option? Beta will be correct
B.
option. Communicable disease. I mentioned that at local level, surveillance mostly predominantly target the communicable disease and environmental hazards. Therefore, beta will be correct option. MCQs 4. A tuberculosis surveillance was done by XYZ public health surveillance team by examining hospital discharge data to identify cases. Which form of surveillance is conducted in this example? Alpha active, beta passive, C sentinel surveillance, delta syndromic surveillance, E event based surveillance.
B.
Beta will be correct option as they actually examine the hospital discharge data. Passive surveillance is done. MCQs 5. A ABC country public health surveillance system produce cancer data and information to assess and describe the burden and distribution of cancer adverse health occurrence. However, the surveillance system of ABC country does not encompass which of the following activities: alpha data collection, beta data analysis, C data interpretation, delta disease eradication, E data dissemination. What will be the correct option?
B.
Delta will be the correct option, disease eradication, as I already mentioned that the public health surveillance does not include any prevention and control disease eradication step. MCQ 6. Effective public health system in XYZ country collect data in standard method. Analyze is open and communicate the result. But which of the following is common way to collect data for surveillance? Alpha action research, beta case report, C quasi experimental studies, delta randomized clinical trial, E disease notification.
E.
E will be the correct option. Disease notification are mostly common method of data collection for surveillance. MCQ 7. Public health surveillance is one of the method that a community can use to monitor its population health by detecting problems. At national level, surveillance trigger which of the following level of activities: alpha investigation of communicable disease outbreak, beta investigation of non-communicable disease outbreak, C specific control activities predominantly for infectious disease,
Meow.
delta specific control activities predominantly for environmental hazards, E monitoring the effectiveness of specific intervention of disease. What will be the correct option?
E.
E will be the correct option, and I already mentioned that at national level, surveillance mainly target the monitoring and evaluation the effectiveness of specific intervention of disease, whereas the investigation of any communicable, non-communicable disease are actually done at local level. MCQs 8. The XYZ public health surveillance team evaluated male patient with prostate cancer at ABC hospital. Which form of surveillance is being conducted? Alpha active, beta passive, C sentinel, delta syndromic, E event oriented. What will be the correct?
B. Passive. Passive.
Alpha active surveillance, as I already mentioned that the team evaluated male patient for prostate cancer at ABC hospital. They don't use any record system. They actually apply surveillance or screening of prostate cancer admitted hospital patient. Therefore, it should be the active surveillance alpha. MCQs 9. Public health surveillance program should improve the public health system efficiency and effectiveness, which is a key factor in population health from a societal perspective. Which four of the following are no typical uses and application of public health surveillance? Alpha identifying treating each case of malaria, beta helping health official allocate disease control resources, C changes in proportion of children in community with high blood levels, delta disease prevention and control program, E chickenpox incidence after a law requiring vaccination. Which of the following are no typical application of public health surveillance?
E.
What what will be the correct option? Data will be the correct option. Actually, I already mentioned in my presentation that actually application purpose of surveillance is to identify any communicable disease, helping the health official to allocate the resources, also describe the changes in the proportion of any blood levels, and varicella incidents after law requiring vaccination are all activities of surveillance. Therefore, Delta will be the correct. They cannot done the disease prevention and control program. MCQs 10. High quality representative data from government owned HIV monitoring system are critical for national HIV intervention, especially among priority population. Which of the following is most effective way to keep an eye on spread of AIDS? Alpha active surveillance, beta passive, C sentinel, delta syndromic, E event based surveillance. What will be the
A.
correct? C will be the correct option, sentinel surveillance. As I already mentioned in my presentation, the disease which are mostly underreported, for example, one of the diseases AIDS, the WHO and CDC recommended to use the sentinel surveillance for such type of disease. Therefore, C will be the correct option. This is the key of my MCQs and thank you.
Thank you so much, Dr. Fansa.
Okay.